Hi, I'm Melissa, a surgical assistant and hygienist here at Drs. Tom and Mark McCawley's office, and I'm here to explain to you some instructions regarding your upcoming implant procedure. Implant procedures are minimally invasive, but there are a few instructions after your surgery to care for your new implant. You will be given a care package the day of your surgery with all of the necessary things inside to take care of your surgical site. Bleeding is normal within the first 24 hours of your procedure. If there is any slight bleeding, you may use the gauze that is provided for you in your care package. You want to simply take a piece of the gauze, fold it into a square, and you want to place it into your implant site and apply pressure by biting on the gauze. Applying pressure for 15 to 20 minutes will alleviate any bleeding, and you may discard the gauze afterwards. While biting on the gauze, it may help to use the ice pack on the outside of your face, as this will help reduce any swelling. We encourage you to practice great plaque control while your implant is healing. Utilizing the soft surgical toothbrush will help keep your implant clean and the adjacent teeth. You can gently use the soft surgical toothbrush in a gentle rolling motion along the adjacent teeth. Try not to brush directly onto the implant head itself. Periodontics spray is an antiseptic spray that we will be giving to you. Please spray this on the implant site twice a day. This is used to keep all the bacteria away from the implant and to keep the area clean. Please allow the antiseptic solution to absorb onto the implant area. Do not rinse afterwards. You must wait about 20 to 30 minutes before you drink or eat anything. For the first 4 to 5 days while your implant is healing, be cautious while eating certain foods. Avoid hard foods such as nuts, pretzels, chips, hard bread, and anything that could possibly put pressure on the implants. Softer foods are recommended until your post-op check with the doctors. For the first 3 months, your implant is very fragile. Avoid hitting your implant on anything hard to prevent damaging it. And for the first 2 to 3 days, you must refrain from strenuous activities such as heavy lifting, bending over, as this will increase bleeding in the area. Light walks are acceptable. If you have any further questions, please do not hesitate to call our office.